And first up and new at 5:30, the Department of Health and Human Services recently announced changes to the number of vaccines they recommend being given to every child.
Now, this is a major change to what has been in effect and may be confusing to some parents. News 13's Eric Cooper is live in Lamar. And Eric, you spoke with not only a pediatrician, but parents as well about these changes, right?
Trishan, that's correct. Parents I spoke with say that they have concerns not only for their child, but also for the general public.
There's a reason that they were mandated in the beginning, and it gave people the opportunity to have this kind of herd immunity that kept the others safe that aren't able to get them, like people that are just allergic to whatever's inside of the vaccine.
Tyler Amerson and Anna Coleman have a 16-month-old named Atlas. Under the new guidelines, the CDC recommends all children be vaccinated against 11 diseases, down from the previously recommended 17 immunizations. Anna says with these changes bring a much larger concern for the general public.
There's some things we've proven 1,000 times over that do have absolute preventatives, things we've almost completely eradicated. And now, because somebody disagrees, you're putting a lot of people at risk. And it's not just kids that get put at risk, it's people with autoimmune disorders, it's elderly people. There's a very small fraction that don't fall into one of those categories. So one person's choice can easily turn into an entire area being affected.
The Department of Health and Human Services says the intention is to increase falling childhood vaccination rates by improving public trust in healthcare institutions. Dr. James Gambrell and his wife Cheryl are pediatricians in Lamar and own and operate Hometown Pediatrics. He says they have been talking with patients for years with any questions about vaccines.
We talk with patients all the time, though, about our recommendations for the vaccines, the side effects, the potential side effects of vaccines, and the efficacy of the vaccines that are already in play. And if parents have questions about individual vaccines, we're always happy to talk to them about that.
Gambrell says with recent changes, it's still a waiting game.
The American Academy of Pediatrics has not necessarily released something new today, but I imagine they're not going to change their stance. That they already agreed to the previously recommended vaccine schedule, thinking it's safe and effective. And so I don't think they're going to change their recommendations for that.
Now, under the new guidelines, the CDC will continue to recommend vaccines for certain diseases, including measles, mumps, rubella, and the chickenpox. Reporting live in Lamar, Eric Cooper, News 13.